We have poor outcomes relative to other countries. We pay twice as much as any other country. We pay more and get.
Did you know that in the United States, a single hospital visit can cost more than an entire vacation abroad? Even people who have health insurance often struggle to pay medical bills. This raises an important question. Why is health insurance in the USA so expensive? Health insurance in the United States is one of the most complex and costly systems in the world. Millions of Americans work full-time, pay monthly premiums, and still receive shocking medical bills. To understand why this happens, we need to look at how the system actually works. In the United States, healthcare is treated as a business rather than a public service. Hospitals, insurance companies, pharmaceutical companies, and medical equipment suppliers all operate for profit. Every test, every treatment, and every prescription has a price attached to it. These prices are often much higher than the real cost of providing care. This profit-driven structure is one of the biggest reasons health insurance is so expensive. Most people don't realize that hospitals list extremely high prices on medical bills. Insurance companies rarely pay those full amounts. Instead, they negotiate discounted rates behind the scenes. For example, a hospital may charge $20,000, but the insurance company might only pay $6,000 or $7,000. The problem is that uninsured patients are often billed the full amount. To balance these negotiations, hospitals raise prices across the board, which increases insurance premiums for everyone. Another major reason for high costs is administration. The U.S. healthcare system has hundreds of insurance plans, each with different rules, billing codes, approvals, and claim processes. Hospitals and insurance companies spend billions of dollars every year on paperwork, billing departments, legal teams, and compliance staff. These costs are not absorbed by the system. They are passed directly to consumers through higher premiums and out-of-pocket expenses. Most Americans receive health insurance through their employer. While this may seem convenient, it often leads to higher costs. Employers negotiate group plans that may not fit individual needs. Over time, rising insurance costs are shifted to employees through higher monthly premiums, higher deductibles, and higher co-payments. Even when insurance is offered by an employer, workers still pay a large portion themselves. Prescription drug prices also play a major role. The United States pays more for prescription medications than almost any other country. Drug prices are not strictly regulated, allowing pharmaceutical companies to charge what the market will tolerate. Medications that cost very little in other countries can cost hundreds or even thousands of dollars in the U.S. Insurance companies are required to cover many of these drugs, which increases overall healthcare spending and raises premiums. Doctors in the United States also face a high risk of medical malpractice lawsuits. To protect themselves, many doctors order extra tests and procedures even when they may not be strictly necessary. This practice, known as defensive medicine, increases healthcare costs. Those extra costs become part of the insurance system and are ultimately paid by patients. Even with insurance, many Americans must pay thousands of dollars out of pocket before coverage begins. High deductibles have become common. Insurance companies use high deductibles to reduce their own risk, but this shifts the financial burden onto patients. As a result, many insured Americans delay or avoid medical care because they cannot afford the upfront costs. Another issue is the lack of price transparency. Patients often do not know the cost of treatment until after they receive care. Without clear pricing, there is no real competition between hospitals and providers. When consumers cannot compare prices, costs continue to rise without control.